Hello, welcome back to Sleep Medicine and Physical Therapy. We're continuing with part 3, physiotherapeutic management of sleep disturbances. Today's topic, physical therapy in circadian rhythm disorders, chrono rehabilitation. I'm Chris, physiotherapy student. Let's start. Every circadian sleep-wake disorder requires a specific treatment strategy. For the success of the treatment, the circadian rhythm should be synchronized with the desired sleep-wake cycle. Physios, together with other health practitioners, treat the patients in order to synchronize the rhythm. Useful approaches may include careful adjustments of sleep-wake times, sleep hygiene strategies, behavioral and pharmacological therapies, exercise, and bright light therapy. The physiotherapeutic treatment starts with the clinical picture of the patient. The anamnesis questionnaires such as the Munich chronotype questionnaire or the morningness-eveningness questionnaire, combined with the actigraphy and sleep diary, can help to set up the diagnosis and to follow up with the treatment regimen. As diurnal animals, human activity, exercise, and feeding primarily occurs during daylight hours, in contrast to sleep, rest, and fasting throughout the night. And we must respect these rhythms, even in the presence of light, technology, and the avatar that we became of ourselves in the contemporary life, constantly exposed to light. Of course, some preferences, whether determined genetically or by the environment, such as chronotype, circadian preferences, and being a shorter, intermediate, or longer sleeper, should be taken into account. Morning larks and night owls. Genetically, we can talk about chronotype. The chronotype is associated with the individual's endogenous circadian clock and determines the circadian preference to realize their activities. The elucidation of molecular clock gene polymorphisms as a genetic basis of chronotype has become a consideration for sports performance. For example, a length polymorphism in the human per3 gene, along with the gene's endogenous circadian expression, has been associated with altered morning-eveningness preferences in the general population, and the longer allele being linked to morning type and the shorter allele with evening type. It is hard to change chronotype. Some even say it cannot be changed, but we can learn how to have the best of our genetic predisposed preference, adjusting it in some types of routines, not extreme ones. For example, a morning type person will always present difficulty to work during the night, and physios can help to ameliorate the difficulties, but no technique or method that PTs can use that transition this person to an evening type. At what time to rehab? Circadian preferences are another factor to be considered linked to chronotypes. Circadian preferences are the propensity for an individual to sleep at a particular time during 24 hours, classified as morning, evening, or intermediate types. Morning type people are individuals who prefer to get up early and carry out their activities in the morning. Evening type people are those who prefer to wake up late and carry out their activities during the afternoon or evening. And the intermediate ones are those who choose intermediate times between two extremes and can easily adapt to either one. Can circadian preferences influence rehabilitation or physiotherapy sessions? Until now, we do not have a consensus on this, even though clinically, I believe yes, they do have an impact on rehabilitation. No systematic reviews with meta-analysis have been made so far. In a recent investigation examined circadian preferences and sleep quality of stroke rehabilitation, the participants were divided into morning type, indifferent, and evening type preferences. According to their responses to the morningness-eveningness questionnaire, all the participants underwent rehabilitation of the upper extremity by the same protocol performed during the morning. It is noticed that evening type patients demonstrated less improvement in motor skill performance compared to morning and intermediate types, as in other investigations. The influence of circadian preference may help within rehabilitation or may represent a stressor at requesting cognition, strength, memory, and motor learning at non-preferred times, having less cognitive reserve to compensate for additional demands in times of stress. These can lead to fatigue and other physiological, psychological, and environmental factors that affect learning, especially motor abilities. The time of the day of rehabilitation physiotherapy session matters, according to the patient's circadian preference and chronotype. Again, there is no evidence to state that the time of rehabilitation should be this or that way. Therefore, some investigations with specific populations are rising. If there is a time of day that we can optimize a session, it means that what we do in this session may act as a Zigberg, a rhythmically occurring natural phenomenon that acts as a cue in the regulation of body's circadian rhythm. It's the German word for time giver. These Zigbergs include social context, the timing of ingestion of food, the knowledge of time itself, the scheduling of normal rest and activity rehabilitations, and possibly the participation in regular physical activity and exercise. Chrono exercise. Could scheduled exercise be used to fix a broken clock? Exercise is a non-photic oscillator and thus independent of the retina and therefore of the suprachiasmatic nucleus. Exercise has a myriad of health benefits and would trigger a metabolic rhythm and physiological responses capable of re-establishing the rhythm, demonstrating its circadian properties. Exercise produces a multitude of physiological responses in humans, including hormonal changes and increased body temperature, which can help to entrain to a new routine. Numerous studies have investigated the effects of exercise on the circadian rhythms of young, healthy humans. Some studies used reentrainment designs in which participants underwent a shift of the sleep-dark period, mimicking night shift work, and exercise was used as a stimulus to accelerate entrainment to the new sleep-wake cycle. Results of these studies indicated that exercise was capable of accelerating the entrainment to the new sleep-dark schedule. Performed during the day, exercise accelerated phase advances, and when performed during the night, exercise accelerated phase delays. Exercise type, intensity, frequency, and daily timing of physical activity impact its efficacy. Some investigations did not involve a shift in the sleep-dark schedule, and these nocturnal exercise was associated with circadian phase delays. Regarding older individuals, a single 3-hour bout of low-intensity nocturnal exercise is demonstrated to be capable of delaying circadian melatonin, suggesting that the phase-shifting effects of exercise are preserved in healthy older adults. In experimental models, some studies show that even in the absence of the central oscillator, with, let's say, the suprachiasmatic nucleus surgically removed, the animals express phase and rhythm adjustment due to the regularity of the offered exercise after feeding at the same time every day. To minimize the phase resetting effects of light, a group of investigators set up exercise in a very dim light condition. For that, young and fit males completed a 15-day randomized clinical trial in which the circadian phase was measured in a constant routine before and after exposure to a week of nightly bouts of exercise, or a non-exercise controlled condition. The authors found that exercise facilitated the shift of the timing of the circadian clock to a 9-hour delay of the sleep-wake cycle. But what are the proposed mechanisms by which exercise can help to change circadian rhythms? There's evidence on experimental studies involving the intergeniculate leaflet, which is anatomically important in the transfer of non-photic information to the suprachiasmatic nucleus via specific neuropeptides, and the serotonergic system may also be involved in non-photic input to the suprachiasmatic nuclei. Yet, there is supporting evidence that the exercise might be a human zitterbird, and that exercise can act as a behavioral countermeasure to facilitate circadian adaptation. Regarding the phase-shifting effects of exercise, there is plenty of evidence which supports its use in clinical practice. Exercise, depending on the time of day or internal time of stimulus application, has been shown to phase shift the melatonin and thyroid-stimulating hormone and increase body temperature, and the activity itself may produce effects of the circadian clock when it's performed at the same day. Recently, the involvement of the vestibular system in the regulation of circadian rhythmicity in experimental studies has emerged. Vestibular inputs seem to be involved in daily rhythm regulation by influencing the CN, independently of direct proprioceptive and muscular inputs. The vestibular system could act normally as an altimeter, providing information about motion during the wake period. Taken together, exercise has circadian rhythm phase-shifting properties, both immediate as observed in assessments of classic circadian hormone and body temperature rhythms, and more long-term as observed by studies on the timing of peak performance. In this view, the timing of exercise, chrono exercise, is important for both entrainment signals and energy expenditure. Until some years ago, we believed that exercise by itself cannot fix a broken clock. The influence of light is imperative, especially for melatonin rhythm, which means its presence but also its absence. Thus, the environmental light-dark cycle is a key entrainment signal of the human circadian rhythm and must be taken into account. In order to optimize exercise as circadian entrainment, light cues could also be part of a physical therapy session, depending on your PT objectives. The exercise outdoors or indoors, what time of exercise and what environment is proposed to exercise. Bright light or dim light, room or natural temperature. Multiple zitterbergs, such as light, noise, meals, or social contexts, may act synergistically or antagonistically. That is, they interact in terms of their push-pull on the circadian rhythm phase. Perhaps, exercise could be combined with other zitterbergs, such as light, to maximize the health benefits and target the physical therapy aim. For example, a patient with delayed sleep phase syndrome and being an evening type needs help to get a job that starts at 8 hours and finishes at the 18-hour mark. This patient has difficulties in being awake during the morning, being sleepy, and having difficulties with concentration and memory. The goal for this patient would be to advance his or her biological rhythm, and for that, exercise should be performed during the day, preferably outdoors and exposure to blue light. With time, 1 or 2 months, the exercise time can be advanced a little bit again. There is no protocol ready to synchronize this patient, but taking into account exercise, sleep routine, light and food, and also the patient's circadian preferences, physios can help to entrain this patient indifferently to his natural preferences, but always remembering that she or he has a preference for afternoon and evening. Therefore, it is important to mention that the American Academy of Sleep Medicine Clinical Practice Guideline for the treatment of intrinsic CRSWD does not recommend timed physical activity and exercise solely. And light became therapy. Bright light therapy is an approach of exposing to artificial light greater than 2,500 lux and for a limited duration of time, practically to mimic sunlight and its circadian effects, hypothesizing that bright light suppresses plasma melatonin level, restores the circadian amplitude in sleep wakefulness, and improves restless behavior, enhancing neural activity in the suprachiasmatic nuclei. Bright light is a promising non-pharmacological intervention that has been applied therapeutically as a treatment for sleep disorders and for compensating circadian misalignments. Some authors suggest that the application of bright light at predetermined times to improve sleep, but especially to promote synchronization between the biological rhythms, and working hours in case of workers undergoing fixed night shifts of work, as well as adapting the context of meals and encouraging the practice of physical activity of these workers. A meta-analysis showed that in general, light therapy is effective in treating sleep problems. Having a routine is a must, and with help to reset the internal clocks. Bright light therapy is offered for the patient by portable units generating about 10,000 lux, and exposure time is about 30 to 45 minutes a day. And the recommendation is to keep the face directed at the light source, but not to continuously stare into the light. The patient can be eating, reading, or working on a computer while receiving light therapy. Cool color temperatures, blue wavelengths, inhibit melatonin secretion and stimulate the production of cortisol, i.e. alertness and activity hormone, while warm color temperatures stimulate the secretion of melatonin. Hence, the treatment must be individualized. Therefore, there is an urgent need for standardized protocols to allow a comparison between investigations and further the writing of a consensus and guideline. Although there is no consensus about the ideal treatment characteristics, there is an agreement about the timing of treatment according to the phase response curve to light. This bright light administered in the morning after the lowest point of core body temperature shifts the biological clock rhythm to an earlier point in time, having a phase advancing effect, whereas exposure to bright light in the evening shifts it to a later time, having a phase delaying effect. Roughly speaking, light in the evening normally causes phase delay, and light in the morning phase advance. That happens because nocturnal melatonin secretion is suppressed by bright light, and therefore can interfere with neuroendocrine hormone production and release timing. The effectiveness of bright light therapy is supported for the treatment of a variety of diseases, seasonal affective disorder and major depression, sleep disorders, and sleep problems related to Alzheimer and dementia, premenstrual dysphoric syndrome, etc. Circadian disruption. It has been hypothesized that chronic circadian disruption may be a contributing factor for the increased susceptibility to diseases of the musculoskeletal system, including degenerative intervertebral disease and low back pain. Chronic circadian rhythm disruption, as experienced by shift workers, for example, has been associated with an increased risk of various disorders and diseases, including insomnia, obesity, diabetes, hypertension, cardiovascular disease, and cancer. The role of the circadian clock within the musculoskeletal system has only recently been studied. In animal studies, evidence shows that disruption of the circadian rhythm acts as a risk factor for the development of osteoarthritis in the mouse knee joint, demonstrating a possible link between environmental chronic circadian dysfunction, such as that experienced by night shift workers and frequent travelers moving across time zones, and the development of osteoarthritis over time. Those authors found that phase-shifting activated catabolic signaling and suppressed chondroprotective pathways in the knee joints of the study animals. Also, mutations in the clock genes demonstrated regulation of bone volume, suppression of long bone growth, and the increased vulnerability to rheumatoid arthritis, suggesting that the molecular clock is important for proper function within the skeletal system. CRSWD can result from alterations in the endogenous circadian clock, such as delayed sleep phase, advanced sleep phase, free running type, and irregular sleep-wake cycle, or from alterations in the physical environment with the endogenous clock, such as shift work disorder and jet lag, as described in the previous chapter. The clinical characteristics and treatment, as well as a result of misalignment between endogenous rhythms and the external environment, the specific mechanisms responsible for most of these disorders are yet unknown. As both behavioral and environmental influences may interfere within the CRSWD, physiotherapeutic interventions need to address circadian physiology along with these influences. Final word. Chronotypes that dictate morning, evening, intermediate type persons are genetic in nature and cannot be changed. To maximize performance, exercise towards the circadian preference. To act as a Zuckerberg, exercise away from the circadian preference. Combine light therapy together with exercise to maximize the phase-shifting properties of exercise. This is all of this topic of physiotherapy in circadian rhythm disorders, chrono rehabilitation. This is Chris, physiotherapy student, signing out.